From the makers of vet-recommended Greenies dental treats comes an easy way to support your dog's wellness. Greenies Smart Essentials Dry Food delivers complete balanced nutrition with science-backed recipes. Greenies Supplements, developed by a team of PhD animal nutritionists, offers options to help support healthy joints, digestion, and more. Whether it's mealtime or mobility support, Greenies helps you care for your dog from the inside out. Learn more at greenies.com.
This is Veterinary Vertex, a podcast of the AVMA journals. In this episode, we chat about how pharmacological therapy for hyperkalemia and feline urethral obstructions has no additional benefit over intravenous fluid and calcium gluconate therapy and prompt unobstruction with our guests, Stephanie Maciorowski and Elizabeth Rozanski.
Welcome, listeners. I'm Lisa Fortier, Editor-in-Chief for JAVMA. I'm joined today by Associate Editor Sarah Wright. Today we have Stephanie and Elizabeth joining us, and thank you guys so much for taking time out of your busy schedule to be with us here today.
Excellent. We're happy to be here.
Thanks for having us.
All right, let's dive right in. So today we're talking about a always timely topic, blocked cats. So Liz, your JAVMA article compares the effect of IV fluids and calcium gluconate alone or with insulin, dextrose, terbutaline, or sodium bicarbonate on hyperkalemia in male cats presenting with urinary obstruction. Please share with our listeners the background on this article.
Sure. So in the emergency room, as everybody's familiar, we see a lot of block cats. And the sicker block cats tend to come with very high potassium levels. And there's always been kind of internal debate over what's the best treatment for that. And we noticed that a lot of people at some point learn to run for the insulin and dextrose. That's probably the most common thing. And then you hear about cats that got insulin that then people forget to give them dextrose, and then they're having hypoglycemic problems, or they don't remember how much glucose to give or how much insulin to give. And so when we were looking at that, that was kind of our driving question was, does it really help to do that? The kidneys are pretty smart. They're not the best organ, but they're a good organ. And they're really good at figuring out stuff. So our thought was, gosh, if we can get them unobstructed, I bet they're going to take care of it pretty quickly on their own. And if we could show that, that would be something that would be really interesting to help people in practice and to help people not worry about the insulin and how much dextrose they're supposed to give. But at the same time, we because we do a lot of dogs, we also see the dogs that bite on the albuterol inhaler and they drop their potassium really, really low. And then when you look into that a little bit more in human medicine, there's some work using the beta-2 agonists, so like terbutaline and albuterol, for lowering the potassium. And I know in JAVMA earlier this year, another article came out talking about albuterol in cats. So gosh, we have terbutaline for our asthmatic cats. I wonder if this would be an easier, safer, effective choice as well, mostly because you don't have to follow it up with anything. And then we wanted to add bicarbonate because that in some of the older textbooks gets a lot of press, says, oh, you can do this by changing the pH. This will help as well. And so as we're talking about that, we're like, well, let's try to set up something where we try to take these head to head to see if we can show if one is really better or is really just unblocking them and giving them fluids and calcium. Is that going to do the trick? So that's how we got to it.
Yeah, super interesting. I think it's good to just remember all the different options. And now we have evidence too, right, behind different recommendations. So thank you for that. So Stephanie, what are the important take-home messages from this JAVMA article?
I think there's two really big take-home messages. The first one is that we always kind of thought that they would have a worse prognosis, these cats, when they came in with this higher potassium. But this study showed that all of our cats survived despite having some really high potassiums here. So even if you recognize that in lab work, still giving these guys a shot with treatment is very reasonable. The other big takeaway is, like we mentioned, all these treatments seem to have similar outcomes where they all did well, and statistically, we didn't see any significant difference between the decrease in potassium over time. So any of these treatments could be helpful. But again, the big priority is getting them unblocked and giving them IV fluids.
Yeah, very important point. We see this in a lot of human and veterinary medicine. Add another drug, add another drug, add another drug. And just because you can doesn't mean you should. And then it just adds up, right? And every time you add a drug, there's another side effect, and then you have to give another drug for a side effect. So I really applaud this effort. Liz, what sparked your interest in this not the best organ? I'd like to know what you think that is the best organ, since you don't think so highly of the kidney.
Well, I do like the kidney. It's absolutely an important one, but I spend a lot of time preaching the major body system, so the heart, brain, and lungs, and so those are the organs that are going to kill you. So when I think as the heart, the brain, or the lungs, I would say they're equally important. The kidneys you can go a little while without working, but you honestly want good kidneys. I am always impressed at how well the kidneys sort out things, and when we have in other debates in emergency medicine, do you give lactated ringers or plasma light or sodium chloride? Really, all the investigations have shown with normal kidneys, give something and they'll be okay. So I do like the kidney from that standpoint. It's just not the best organ out there.
Well, in this specific topic of comparing all these medications head to head, what was the impetus for this study? What sparked your interest in this topic?
What sparked our interest is, again, years of block cats that come in with hyperkalemia. And one of our co-authors, we call him VK because we can't pronounce his last name either. Steph might do better with it. Do you want to give it a try?
Oh gosh, I can't. I still go by VK.
We call him VK. And he is a bit of a curmudgeon. And he is one of our co-investigators. He was a resident here a couple years ago, and he was constantly fighting with us for what the right answer was and where was the evidence. So really, really intellectual, as well as combative, but in a good way. And it was really his idea as far as can we try to look at these things because we are having a lot of, when we think about fun things in emergency medicine, there's so much that we still don't really know. It's kind of fun to have good debates over what do you think you should do? What would we do? And then a lot of the block cats, because they're so common, people learned something in veterinary school or in their first year or two out, and they never really questioned it. And so there's been, how do we like flushing the cat's bladder out? Is that really helpful? Is there other things that we kind of do out of tradition rather than evidence? And so VK was great for let's look at some evidence. And we had a run of really badly hyperkalemic cats. And we're always upset where different places people say things like, oh, these guys are never going to survive. Like you should just euthanize them. And so we really were like, I think they do pretty well. Let's see what we can do with that. And then we spent some time trying to make sure they were as matched as possible because obviously different people use different drugs or different fluids. So it took a little while to make sure we didn't miss a cat as far as doing something different. But yeah, that's the really interesting part about where's the evidence.
Yeah, I'm a large animal surgeon. We have the same thing in block goats. They're frustrating. They can be expensive, and then they recur. And yeah,
We're doing a project with our large animal folks looking at block goats as well, just as kind of for that same thing that you're talking about, kind of that overlap between species and how we can work together.
yeah, yep. All part of probably what we're doing is feeding them. It was a Western diet. I doubt all those goats out in nature get blocked. There wouldn't be any goats. Every time, Liz, that we do a study, and this is a fabulous study with all the different groups, but we're always surprised by something. And I think one of the surprises I've heard is that the animals do better regardless, or they do well regardless of a high potassium. What are some other surprising findings?
What did you want to? I think to me, other surprising findings was that the potassium falls fairly quickly, and I think that that's something where from a clinical standpoint, if you recheck laboratory work 24 hours later and it's not better, you really should be anxious over that. And we don't really have a lot of good data over like what does creatinine or potassium do every half an hour or things like that. So I think we need a little more looking at that. So I was pretty impressed within a couple of hours that the cats were back to what we would consider a cardiovascularly safe range. The other thing that's probably important to note is we gave the cats a fluid bolus pretty quickly, but we also unblocked them pretty quickly. And I think sometimes people talk about trying to make them more stable. And I think to me, it's really important that the thing that's going to make them more stable is unblocking them. And so, in our hospital, certainly a not sick block cat might wait 15, 20 minutes to get unblocked. But these guys are, I think, pretty big all hands on deck because they're going to be fixable. This is a disease we can improve the outcome. They're going to do well with that. So that to me is something I'd like us to kind of focus on as a profession as these guys come in, get them some fluids, get them unblocked. So I know.
Amen.
Yeah, I don't know what Steph would add to that.
Yeah, and I would say that along with the concern for mortality going into these cases, all of these cats did really well. But I think the big thing was getting them at least some fluids and the calcium gluconate and then just getting them unblocked as soon as possible is Again, just the most important thing to get these guys on the road to recovery.
I think the exact same for the goats. We have these debates from surgeon anesthesia about we need to stabilize them cardiovascular for surgery. We can't anesthetize them with that calcium. And I was like, well, what do you want me to do here?
Exactly. You have something we can fix, so we need to work on that.
Yeah, I do feel like sometimes we get so caught up with trying to treat the clinical signs that we forget the underlying root cause. And sometimes if you address that root cause head on, then you can fix everything else. It'll resolve. So Stephanie, what are the next steps for research in this topic?
So I think a little bit of what Liz alluded to was seeing exactly how quickly this potassium drops. We only looked at the one time point 4 hours after. If we were able to check that more often, I think that would be really interesting to look at as well. Another thing to consider would be looking at other lab work changes. We had looked into the creatinine, but also maybe looking at their ionized calcium as well would be really interesting in these cases. And maybe even looking at ECG changes in these cases as well. We all know kind of the classic ECG changes, but actually seeing clinically how that correlates with the patients coming into the ER would be really cool.
Yeah, I would definitely look forward to that. Sounds really interesting. Well, we hope to see some more of your manuscripts then across Stardust. And Stephanie, do you see a role for AI in this area of research?
That's a great question. I feel like that's the hot topic nowadays as to whether AI could come in. And I think, maybe it could come in to help go through different treatment options. But I think at the end of the day, we have so much knowledge and experience that I don't think AI will ever really replace that in our veterinary expertise.
Elizabeth, you talked earlier about a resident that you had that was maybe a bit challenging. I think those folks are fascinating. Oftentimes it was students from me that would say, do we know that for sure? Is there evidence for that? And sometimes that sparks some of my best studies. So how did your training, or even you being a mentor, how did that prepare you to design this complicated experiment and then write this article?
Oh, yeah, that's a great question. And so to be clear, we love VK, but he is a curmudgeon. I think that what you're looking for in any veterinarian or veterinary technician is intellectual curiosity. And so certainly there's times to from a surgical standpoint, we always tell people you should never ask, is it supposed to bleed that much? That's a bad question. But asking questions about things that you learned. I think one of the interesting debates that's really hot right now is, when do you spay and neuter dogs? Like, how do we answer those questions? How do you answer the question? We do a lot with GDV as well. And when you look at the history of dogs with bloat or GDV, it was, we figured out finally, 50 years ago, give them fluids, and maybe we could take them to surgery, and so each little widget gives us more information. So to me, we at Tufts, as well as a lot of the other veterinary schools, of course, have a pretty active student summer research project. And I love seeing what they come up with as their ideas. And so from an ER standpoint, there's really a million unanswered questions. And I think just keep picking away at each little question is really fun. So we love the people who come up with, what do you think we should do? We had one student this summer who was looking at, do the dogs sleep more if the lights are off in the ICU? And this is perhaps one of our best statistical findings, is that using our light meter, it's significantly darker when the lights are off. So that's what she found as her project. But the rest of it, she found that dogs didn't really care if the lights were on or off or how loud it was. They were happy to sleep no matter what. And so that was really those type of questions that seem kind of common sense really aren't sometimes common sense. And so I think as a profession, as we keep kind of picking those off, those are great. And we love the students and house officers who come in with, hey, I'd like to question what I think we should be doing and try to answer that a little bit better. So those are fun questions.
So now this next set of questions is going to be really important for our listeners. The first one is going to revolve around the veterinarian's perspective. So Elizabeth, what is one piece of information the veterinarian should know about resolution of hyperkalemia in cats presenting with urinary obstruction?
To me, the most important thing is give fluids, give calcium, and unblock them. And do it quickly. I think that we stratified our anesthesia sedation protocol, but using drugs that you're comfortable with and using conservative doses of them and unblocking them quickly. If you can't get them unblocked, luckily, as you remember, potassium kind of lowers muscle tone. So most hyperkalemic cats are actually easier to unblock than some of the other cats. But if you can't get them unblocked, you can also do a decompressive cystocentesis where you actually get rid of all the urine, not just a 5 ml sample, but like hook up a inch and a half 22 gauge needle and take off 100 or 250 mils. And if you can't get them unblocked, that will help as well. So to me, the biggest take home is these cats are absolutely fixable, but you need to act quickly. And I think we need to make sure you talk to the owners about what to watch for, and making sure that they're aware that this could happen with their cat.
My sister-in-law just adopted a male cat, and she's already asking me. She's like, "So I heard they need to drink a lot of water." I'm like, "All right, we got some things to discuss here." So, Stephanie, on the other side of this relationship, what's one thing clients should know about this topic?
I think the first and most important thing is knowing that this is a problem. If your male cat is going in and out of the litter box a lot, you're not seeing regular urinations, or some stressful event, like keeping an eye on that and getting them into the vet as soon as possible. Like, I would much rather have the cat that the owner is concerned they're blocked and they're not actually blocked than the one that's coming in, peri-arrest really sick. So I think the biggest thing is just client education about this problem. Because then from there, discussing we can treat this, the different environmental modifications, things we can do from there are all education points that we can work with on the clients. But they first need to know that this is a problem that they should just be aware of to try to help out their little kitties at home.
Very good point. Thank you again, you guys. Such a timely and always a timely and important topic for veterinary medicine. As you wind down, we like to ask a little more of a fun question. So, Liz, we'd like to know, what was the first concert you attended?
First concert was Billy Joel at the Rosemont outside of Chicago when I was in high school. That was
Very cool.
a good concert.
Yeah, he is still very good. And Stephanie, you're an ER doc. I'm not sure what the answer to view of this. Sarah and I have a hypothesis, and we're going to do a little study on this question. When you complete a puzzle, Stephanie, do you begin with the middle or the exterior, or do you do a pattern? How do you approach a puzzle?
So you have to always do the edges first. I feel like that's chaotic
Yeah.
or in the middle.
So what's panning out is anybody who has like a surgeon mentality does the exterior, and medicine folks usually do the interior.
Oh, really?
So you're as an ER doc, you're kind of a hybrid.
Yeah, absolutely. Yeah, I can imagine not starting with the edges.
Right? I tend lean more surgery than medicine too anyway, so that seems to fit.
Right. It's awesome.
Yeah, we're gathering a lot of data for this, Lisa. I might have to do something with it at some point.
Evidence.
Yeah, exactly. Well, thank you so much, Stephanie and Liz. We appreciate you being here today, and also for sharing your work with JAVMA.
Of course. We're very happy to be here.
Thank you guys so much for having us.
And to our listeners, you can read Stephanie and Elizabeth's article in JAVMA. I'm Sarah Wright with Lisa Fortier. Be on the lookout for next week's episode, and don't forget to leave us a rating and review on Apple Podcasts or whatever platform you listen to.